It's maybe useful to start out with the fact that health services account for a large part of GDP. 9, 10, up to 16% in the US. So we're talking about large amounts of money that policymakers want to follow over time. Okay. So if health expenditure goes up, a very important question is, does it go up because you get more health services, or does it go up because it has become more expensive to get the same service? And depending on the answer, your health policies will go one way or the other. So getting the data on health expenditure right is very important. Now, there's a number of challenges associated with measuring health. And probably three of them, the most important ones, are that health is a service sector. And in general, it is harder to measure services than goods in the economy. Something that is tangible, that hurts when it falls on your foot, is easier to measure than a service that involves interactions between clients, patients, and the service provider. Secondly, it is always hard to measure goods or services where you have a rapid change in the quality of the goods or services provided. It's hard to measure the quantity of computers because you have a quick change in models. The new iPhone is not the same as the old iPhone, so how do you compare the price of the two? The same is true for health. There's a lot of quality change in health provision. So a hip treatment this year may be quite different in quality from a hip treatment a year ago. So if you only compare the prices for two hip treatments, you may get something wrong because you don't compare the same things at the same time. And the third reason why it is hard to measure health services correctly is because in many countries the health services are provided by government. So it's not a market service that comes through, and so there is no market price. If you go to a doctor, if you go to a hospital, very often you pay only a small amount. In some cases you pay nothing, and of course that's not the price of the service. Whereas if you have a good service that is purchased on the market, all you have to do is go out and look for that price. So there are a number of reasons why it is important and difficult at the same time to measure health services, and that's why it is important to work on these questions. Well, that brings us to a more general question about what drives growth in our economies. And some years ago, and we did, the OECD has always been working on the sources of growth. A little while ago, I did some specific work on this. One source of growth that was very prevalent in the second half of the 90s and in the early 2000s was information and communication technology. The idea that by bringing in investment in these assets, you would experience economic growth. Now, to a good deal, that was actually the case, even though we all remember the dot-com boom and bust, where there were many new and IT-related companies set up, which didn't make it very, very far after 5 or 6 years at the beginning of the years after 2000. Now, the challenge is to bring these elements into the economy as a whole. Okay, you want the economy as a whole to become more efficient, to increase productivity, and a key source of productivity growth is innovation. And I think innovation is what will determine the medium-term growth perspectives in the OECD countries, and of course in Spain as well. The OECD has just published a major study on innovation, which tries to think about how to measure innovation, but also what are the advices that governments can use to improve innovation. Now, Spain has one other thing where it is somewhat different from other OECD countries. Certainly right now, during the economic crisis, you have seen the Spanish unemployment rate basically double, going up very quickly. So it means there's a large population, a large part of the workforce that is underutilized. And so, of course, one way of stimulating growth is to try and bring labor back into activity to make use of this important underutilized source of growth in Spain. What we did then, as I said, there was a lot of focus on what we call the supply side. So on the areas or the industries in the economy that produce ICT, computer producers and software firms and R&D and software deliverers. And I think since then the thinking has moved on, and we've seen the developments in this sense also, that what matters is really how information and communication technology diffuses in all parts of the economy. Okay, so mining, agriculture, steel, but also the service industries are becoming more and more important users of ICT, and there it plays an important role in this context. So ICT is not only something that is to be seen from the supply side. It is now increasingly clear that we need to see it from the input side of the economy as well, and use it efficiently there. But ICT is very closely connected to innovation. It's kind of R&D, ICT, innovation. These are areas that are closely connected, and this, I think, will determine the medium-term growth paths of our economies. Productivity, as we measure it, and as it has been measured, is basically the expression of innovation and efficiency gains. Okay? And the productivity contributions to economic growth have been, fairly stable over time, and even though there are large variations between countries, and Spain actually has been rather on the lower end of the productivity performance in the OECD countries. So there's certainly something to think about, and again, it takes us back to the issue of innovation, human capital, research and development, because these are the driving forces behind productivity growth. One of the main messages of the Sen-Stiglitz-Fitoussi report was that our measurement should not only look at the production side of the economy, which is incarnated by GDP. Everyone looks at GDP and GDP per capita, which is important, but it describes what is happening on the production side, of the supply side of the economy. What the report says is you want to look at what happens to people. And what happens to people is not necessarily what happens to the production or to the supply side of the economy. I'll give you an example. There has been a long debate in France on what is called le pouvoir d'achat, okay? So the purchasing power of people. And because people have seen that the government statistics show GDP per capita going up, but they felt, in their own pockets, their purchasing power hasn't improved in the same way. And one reason for that is that the overall GDP growth is not a very good indicator of how disposable household income evolves over time. So you want to use more measures that focus on what happens to people, what happens to households, what happens to individuals, both in the area of income or material quality of life, but also things that go beyond income. There are other dimensions of the quality of life that matter to people, and which are not sufficiently brought out in our measurement systems and in our communication on how well off societies are.